About 2 years ago, I was in a particular hospital for a training, and I walked into the postnatal ward to look for someone. Inside this ward, women who have delivered stay there with their babies until they are fit to be discharged. So as I walked into this ward, I noticed a woman on the first bed holding her baby and chanting calmly. And I looked at them in admiration. But when I looked at that baby a second time, I noticed the baby's color was not normal. So I went close to the woman's bed, introduced myself to her, and asked her permission to look at her baby closely. I suppose my word coats made it easy for the woman to trust me. So I bent over, touched the baby's body, and what I noticed was jaundice. So I told the woman to please inform the nurse midwife on duty that she needs her baby to be examined. This woman snapped out. She said, "God forbid, there's nothing wrong with my baby. I delivered normally and I'm waiting for the doctor to discharge me. Please, my baby is fine and nothing is wrong with my baby." Thanks to God, her husband walked in and agreed as I had just suggested. So I walked away. A few minutes later, that baby was sent to the neonatal unit and admitted for the treatment of jaundice. Of course, the rest is history. Not everyone will have an encounter with a health professional for early detection of jaundice. So what I wish for is that by the end of this health talk, we'll all be equipped with the proper information to detect abnormality with baby's skin color. Juliana Ome is the name, and you already know our topic for today. Jaundice is the yellow discoloration of the skin and the white parts of the eyes caused by a yellow substance called bilirubin. Jaundice is the most common condition that requires medical attention and hospital readmission in newborns. Jaundice can happen in all age groups, even in adults, but for today's health talk, we shall look at the jaundice that happens when a baby is less than 28 days of life. This type is called neonatal jaundice. Now, there are two types of neonatal jaundice: physiological jaundice and pathological jaundice. Physiological jaundice is a type of jaundice that appears on the baby's body after 2 days of life, while pathological jaundice is the one that appears on the baby's body within 24 hours of delivery, and it is worse than physiological jaundice. It is caused by different things, like when a mother and baby's blood do not match, that is ABO incompatibility. It can be caused by sepsis or a disease called glucose 6-phosphate dehydrogenase deficiency, and so on. Now, for the physiological jaundice, this is what happens in the body. The human being's blood is red in color because it contains special cells that are red in color, which we know as the red blood cells. Okay? These red blood cells die every 90 to 120 days in an adult. Now, as they are dying, new ones are being formed. And the way God designed the human body, it is organized to handle different things at the same time. So when the red blood cells are old, the body will start breaking them down and forming new ones. And the final substance formed from the breakdown of red blood cells is called bilirubin. Bilirubin is yellow in color. Now, bilirubin is supposed to undergo another chemical process inside the liver before it will come out in the urine and our feces and leave the body through the process. But for newborn babies, their red blood cells last for about 80 to 90 days, so they produce more bilirubin than an adult. And also, the liver of a newborn baby is not yet strong enough for the chemical process that will handle bilirubin in the baby's body. So bilirubin will be everywhere in the baby's blood, and the baby will become yellow. If you check the baby's eyes, they will appear yellow. If you touch baby's body and remove your hand, the body will also appear yellow. This is worse if that baby is born premature. Now, someone might be wondering that a newborn baby that is not even up to 10 days old, why would the red blood cells, which are supposed to last 80 to 90 days, be old already? The red blood cells of a newborn baby have been growing, breaking down, and renewing inside the womb since the baby has been growing for the past 9 months. That's about 270 days. So this process has been happening inside the womb. But while baby was inside the womb, the placenta was helping to remove the bilirubin from baby's body. But now that baby no more placenta, so the baby's body will have to do the work by itself. And that's where the issue begins. So jaundice is caused by excess bilirubin in the blood, and not when a mother uses yellow wrapper or eats banana and yellow fruits or yellow food, or when she uses yellow linen to carry the baby, or wear baby yellow dresses. Those things will not cause jaundice, okay? Meanwhile, the treatment of jaundice is by the use of phototherapy. Phototherapy is a special blue light that a baby is placed under. Now remember I said there's a chemical process that happens inside the liver that helps the body to remove bilirubin in the urine and feces, right? This blue light is now what will help that chemical process to take place. And that is why when you place your babies under this light, you remove baby's clothes so that light will shine on the baby's body and help to remove the bilirubin. And if jaundice is not going away with phototherapy, there are other things that will be done for the baby. There's a special type of blood transfusion done for the baby to remove excess bilirubin. This is called exchange blood transfusion. Because if you don't treat excess bilirubin in the body on time, bilirubin may enter the baby's brain and damage baby's brain for life. When the brain is affected by jaundice, it is called KERNICTERUS. And once this happens, the cry of the baby will be high-pitched. It will be a very different type of cry. The baby may convulse and the baby may even die. But if the baby survives, that baby will not live a normal life. Some of these babies cannot walk properly, they cannot talk properly, because the brain is the controller of all the movements our body make. And once the brain is affected, there's no way the body can coordinate itself properly. And again, the ability for the child to reason will reduce. Affected children will not be able to attend normal schools and be able to do the things that their fellow children do, because they cannot use their brain for complex activities. And the child may also have hearing loss, mental retardation, and so on. As usual, I will address certain mistakes that people make and myths about jaundice. Because of some dangerous advice some people give, some families are still sorrowful even after many years of giving birth to a child. Now, these are the most popular things that people tell new mothers who have babies have jaundice. They'll tell you, give the baby glucose water, put baby under morning sun, give baby ampiclos drops or antibiotics drops. Some medicine stores will tell you to bring the baby there, they'll give you drugs, they will treat the baby. Please don't listen to them. Take your baby to the hospital before it is too late. Some mothers have made such mistakes and baby's brain became affected. And once baby's brain is affected, there's no remedy. So the best way to handle this is by prevention and to be very careful. Please, mothers, attend antenatal care. Anything worth doing is worth doing well. Once you decide to have babies, please create time and go through the processes of pregnancy and childbirth properly. So if there's any condition during your pregnancy that may affect your baby, it will be noticed and taken care of before baby is born. And mothers, deliver your babies in the hospital. God has made life to be orderly, such that everyone has their special responsibilities. The doctors and midwives have gone through years of training just to take care of you and your baby. Go to them for help. Deliver like Hebrew in the hospital, please, so that any abnormal appearance of your baby will be noticed on time and taken care of. Remember that encounter I had with a patient in this hospital? What if she delivered in a local home? Something might go wrong. Now, when your car is bad or it has faults, you take your car to a very good mechanic. So why will you go to a quack when you need health care? It amazes me, but it is very common. A lot of women and children have suffered bad consequences of quack practice. Go to the hospital for your care. Please, parents, on no account will you deliver your baby and allow people who made themselves doctors because of their experience to treat your baby for you at home. Go to the hospital. Help your babies. Once you see anything abnormal, run to the hospital. The woman who is advising you may not mean harm, but she does not have what it takes to help you. She does not have bad intention, but she's not able to help you well. So please, let us all be careful. I hope you found this health talk informative, because if you know better, you will surely do better. I love you all, and I remain your favorite health talk personnel on YouTube. Please do well for your questions and your comments. And of course, do well to click on the like button if you learned something from this health talk. And again, subscribe if you're yet to.